Shaler Township Police Department, going to give you a more local perspective of what we're seeing in our areas. Thanks.
How is everyone? Pretty good PowerPoint that Mr. Dempsey gave, very informative. I was able to view that a few days ago and I was taken back by it because we don't know all those stats that the DA has, and they're pretty important to know. So we're having this, there's a main reason we're having this. We've talked between Chief Rodman, Chief Frank, and myself. We've had this discussion about being more proactive towards these issues, okay? Police often react to things and they're not proactive. That's changing, and I think for this situation with the drug overdoses, we have to be proactive. And that's one of the reasons why we're having this sort of town hall. We've had these before with the school, and we've talked about this. But things have changed. The drug world changes so much. I've been a police officer 27 years, and I've seen the changes. And, you know, with the xylazine that's popping up in the crime labs, we didn't know what it was. We researched it. It was a horse tranquilizer. And we were like, wow, why is this in what's supposed to be heroin or what we were seeing as fentanyl? And then we contacted the DEA, and they were kind enough to come out and help us with this presentation. So I want to talk about some local things that are going on within Shaler Township and the surrounding communities. I think Mr. Dempsey touched on like a national or even in the state of Pennsylvania a little bit, or the western region. But ours is kind of unique sometimes because we play catch up a lot of times. Maybe it's happening in Philadelphia or some other big cities, and then all of a sudden it enters Allegheny County and specifically Shaler, and we see that. So we want to talk about maybe what's going on here in Shaler locally, and what we're doing to try to help out and be proactive. Like I said, one of the things we're doing is we're trying to educate the community on what to look for, what we're seeing out there. You know, when I went to college, I saw marijuana at college, right? I had never seen heroin. I had never seen meth. If you do not deal with law enforcement, EMS situations, you may never see that in your life. You may never see it unless you have a loved one that's maybe addicted to that. So it's important to get the message out and to try to, you know, explain what's going on. We installed a drug take-back box at our police station. I don't know if anyone's aware of those. And what we do is we try to get the drugs from houses. Someone's prescribed Percocet, oxycodone. They maybe take 2 or 3 of them, don't want to take them anymore. That bottle is sitting in their medicine cabinet. It's so easy for a kid to get that bottle, take those pills to a party, share them with kids, and then we have kids that are addicted. You know, over the years, I've investigated burglaries, robberies, and one burglary, somebody that I had arrested, I asked that person, how did you get addicted? They were addicted to heroin. And just what I said, somebody brought pills to a party that were left over. So, you know, for us, we thought that was very important. And I have some stats that are pretty shocking of how much weight of pills. What we do is when the box fills up, it's kind of like a mailbox it's in our lobby at the police station. We take those out, we package them, we seal them, we keep them in our evidence room, and then we go and destroy those with the National Guard or with the DEA at the takebacks here at the library. So we installed that box in July of 2016, and we have destroyed 4,372 pounds of medication. Now, it's not all Percocets and opioids. You know, there could be some, you know, antacids in there. But 4,372 pounds just in this area that we've destroyed since 2016. And we want to get those pills, those leftover pills out of the houses so they can't be used to cause problems. So that's important for us to do. Part of being proactive, like I said. So we're talking about xylazine and fentanyl. And what I did, so I do I take all our drugs that are getting tested to the Allegheny County Crime Lab, the medical examiner's office. I get those reports back of what's in each drug. So if I take heroin down there, what we think is heroin, I will get a crime lab report that says it's heroin, or it's fentanyl, or it's xylazine, or it's whatever is in there. If it's cocaine, it'll tell me if it's cocaine. So what happened was, and I think I'm going to answer part of somebody's question over here is, in April of this year, I got a crime lab back that said xylazine and fentanyl. And the chief and I talked, and I said, I looked up xylazine and said horse tranquilizer. I'm like, what is going on here? We called the crime lab and got an answer that, yeah, xylazine is popping up in drug reports now. And at the time when we called, it was not illegal in this state. So we could not charge somebody for having xylazine. That has recently changed, and we are able to charge that now. So I went back on some crime labs just to show you what's going on here in the area. Like I said, April of 2023 was the first time that xylazine was seen in one of our crime labs. Since that xylazine positive test, my next 4 labs that are, we call them heroin because they're stamp bags and there's powder in there. So we've always called it heroin, but it's not heroin anymore. 4 since that one in April, they've all had xylazine in them. So the last 5 crime labs I've received back, they've all had xylazine. Xylazine and fentanyl are mixed together in those bags, okay? Of 7 labs this year, only 1 lab that we thought was heroin had heroin in a bag, only 1. So it's been all fentanyl or xylazine this year. And then just to rewind and go back a little bit, fentanyl has been in our crime labs from 2021 and 2022. Every single lab has had heroin and fentanyl. There's not been one lab that was pure heroin testing positive, which is shocking. So it goes back to, I think, what you were saying about fentanyl.
I thought they were cutting it.
Yeah, and so it was mixed. So we're getting either pure fentanyl bags or fentanyl and heroin mixed. So going back to what Mr. Dempsey was talking about, is it's all about money. It's cheaper to sell fentanyl than it is the heroin. So it's more powerful. It's 50 to 100 times more powerful than heroin, and it's cheaper. So, and you can get more out of what you have. So that's the reason for that. We don't know how strong it is. If you're prescribed an oxy 5 milligram pill, you know what you're getting. That's what it is. You don't know what's in each bag of heroin, and the users don't know what's in there, and that's why we're having the overdoses. If they're used to doing 2 or 3 bags, and they do that, and it's a stronger dose, that can lead to an overdose. So I went back a little bit further just with the labs, and it looks like it starts, what we're seeing here is 2017, we were getting just heroin in the bags, and then a little mix of fentanyl, and then since then, there's been fentanyl in almost every crime lab that we get back. So just to show you what's going on in this county. Kind of what spearheaded this a little bit to get it moving a little faster of having what we're doing tonight is we had a local officer that was dealing with some evidence, what we thought was heroin or fentanyl, and he was moving, if we seize drugs, they're in stamp bags, they're in plastic bags, we put them into envelopes and seal them to keep them safe and take them to the crime lab. He was moving some of the drugs, and it got airborne. It moved and it got airborne, and he actually started to overdose. To the point that he grabbed a Narcan, and he grabbed somebody and said, hey, if I go out, before the ambulance gets here, here's how to use this. So it kind of, it scares us. We've been trained on that. We understand the exposure, and we understand not to touch it or not to breathe it, but it can happen. If it can happen to an officer that's aware of it, it can happen to anyone. So we want to get that message out to everybody. You have a loved one or somebody that's involved in drugs and you find some drugs, don't touch it. Call us, call the police, let us handle it. We have currently Narcan in every police cruiser to administer to people that are overdosing or accidental overdoses. So, that's something scary, and kind of woke us up that somebody we know locally almost, went out from it. So like I said, the drugs are continuing to change. Who would have thought xylazine? I've never heard of it. We've been in law enforcement a long time. What's the next thing that's going to be involved in these stamp bags that we're getting? And it scares us, and we want to try to educate and let everybody know what's going on. So Anyone have any questions?
Is there a plan to create a spot for Narcan to be on your person?
Just for anybody, or
For police?
they have it in all the cruisers?
Is it planned to be like in a holster at all?
I don't know. The chief would know that better than I do. We have medic bags in each cruiser.
Yeah.
That has some different, inside those medic bags is Narcan. So I don't know if it's gonna be on their duty belts.
I'm just thinking, what if you run into a house and you don't have a bag and then you have to go get it?
Yeah, usually the dispatch calls are, an overdose or something drug, and they take that bag with them when they know it's an EMS related call. So, good idea though.
Is that only a one-time use for that Narcan? How does that work?
Chief?
I mean, I'm just curious.
I'm gonna let the medical people talk
Yeah,
about
they're
that.
gonna talk
Okay, okay.
That'll be,
Yes.
I'm just curious, like you said, we haven't heard of Xylazine, this is until recently, I haven't either. Who found out to take horse tranquilizer?
That's a good question. I don't
Did
know
someone
that.
accidentally do it, and then all of a sudden say, hey, this is
Yeah.
great?
I don't know if the DEA have that answer. I know I don't. I was as shocked as anyone to see it. I didn't know what it was. Like I said, I did a Google search and saw it was horse tranquilizer. And our next call was to the crime lab saying, why is this in, mixed with fentanyl? And that was April. It's November, and we're having this town hall to try to educate everybody about it.
Do
Yes.
you know that when people are purchasing it, are they still trying to purchase heroin? Are they now just like trying to purchase fentanyl? And if they're getting it laced with xylazine, are they trying to get the zombie drug? Or, like,
Yeah, so that's a good question too. I think they know what they're getting, and I think it's word of mouth. How the stamp bags are, they're marked with different pictures or sayings on their words. So it could be a cartoon character, it could be like Popeye on there, and word of mouth goes along, and they say, so they if they're getting their high that they want, it doesn't matter to them what they're using.
I'm sorry, I just forgot to mention something. For the people I've talked to that have used fentanyl and xylazine, they tell me that xylazine gives fentanyl legs, that it makes the fentanyl high last longer, extends it. So that's why they're mixing the xylazine with the fentanyl. That's another reason as far as cost and avoid law enforcement scrutiny, but it does enhance the fentanyl high, does make it longer.
Yes, sir, but again, how did the drug user or mixer find that out, that Xylazine and everybody?
I think they're always experimenting with something. And it's all about the money, like Mr. Dempsey said. I mean, if it's, cost effective for them, they'll put anything in there. They don't care about who's using it, they just want that money, so. And I'm sure we're gonna come across something else in the near future that's like xylazine that's gonna be in these bags, that we're finding.
And just real quick, we just had an incident. There was one individual that's all they're seeing is the xylazine, and they wanted to see fentanyl. They wanted to go find it, but they can't find it on the streets right now. So because that's what it's being mixed with. So there are some individuals that are trying to sway away from that, but they're having a hard time locating it because that's what's mixed in with the bags also.
Any other questions? Yes.
Intentionally asking this, obviously, but if I'm a family member after somebody suffers an overdose and I stumble upon some drug paraphernalia, you'd suggested to call law enforcement. I might be afraid of repercussions for myself or my loved one. Could you just touch
So
on
there's
that?
a Good Samaritan Act in that if somebody does overdose, the people they call or the people involved will not get charged with any crime. So yeah, we would rather get it out of the house. We'll destroy it. We'll do whatever we have to do. You don't have to have that sense that you're going to get, prosecuted for anything like that. Good question. Yes.
One of the questions online is how much xylazine is needed to get necrosis in someone?
Mr. Dempsey, help me out here.
It's just, you never know what you're getting in these stamp bags. You never know. It could be 10% of the bag could be xylazine or 50% of the bag. You never know because there's no science to this. So they're just mixing randomly. So from my understanding, from talking to doctors, any amount of xylazine when you inject it is potentially dangerous because you just don't know. And that little bit of xylazine, like I said, could constrict the blood vessel, and that's what, and the blood doesn't get to the skin tissue, and that's what starts that rotting process. So that answer, that's the best thing to do.
Thank you. Anyone else? Any other sharing online?
But passages might have an answer.
I got a question.
Yes.
There's a side effect sometimes Narcan don't work on, so they suggest oxygen, because oxygen brings back the level of.
I think we have the medics.
We'll talk
We're
about
gonna
that.
talk about that. Yeah, we have some other, they can maybe get on the medical side of things too. Like I said, the xylazine is brand new for us too. We did not know it existed prior to April of this year, and we're just learning about it as well. That's why I said the PowerPoint that the DEA showed was very informative for us that I reviewed just the other day. I didn't know all that until I reviewed it prior.
But I believe there's a lot of things that will give the resources at the end and stuff like that, but there are test strips for xylazine to test the needles and stuff like that, because pretty much as the needle's going in, it's coming in contact with that skin and it's going down into the bone. So there are test strips that are available to test the stuff too.
So with all the questions, you can see why we're having this. Like, we want to keep everybody informed of what's going on, what's in the community, what's going on in the areas with the drug. If you have family members or friends that might have an addiction, we want you to be aware of it. Kids, parents, whatever it may be. So that's kind of the main reason we're doing this today. Any other questions? Okay, thank you.
Okay, I did fail to mention for the people online, if you do have any questions, you can certainly put them in the comments. All the speakers are staying till the end, and we can answer as many questions as possible. And we're going to bring our medical professionals up because there were some medical questions in that last segment. So we have Eric Schmidt from Shaler-Hampton EMS and Greg Porter from Ross Westview EMS. They're both the directors there.
Thank you.
So happy for the opportunity to talk tonight, and Greg and I are just going to kind of tag team this. We work a lot together on many different things. So I want to talk about, first of all, we talk about the bad uses of fentanyl and ketamine. I do want to say that those are both drugs that we carry in our ambulances and use for good uses. So they're good things used in a bad way. It doesn't mean that we don't use them in a good way that benefit our patients frequently. They're very good when used, manufactured in the correct way, administered in the correct way, and they're very safe and beneficial to our patients for pain control. It's, used the wrong way is bad, but it's inhumane to not treat somebody's pain who's experiencing it. Those are two drugs that we use very successfully to treat pain. So I want to mention that first of all. Second of all, we've been dealing with narcotic overdose for some time. And all the time I've been doing this, we've had Narcan available to us for the entirety of my career. But we didn't use it hardly ever for the first, 20 years. It was something we had available but almost never used. And now it's something we use very routinely. And now it's evolved to the point where we get there and others have used it. Family members, friends, police officers. We're very, very fortunate in the 3 police departments I work with primarily, and the 5 that Greg works with primarily. All the police departments carry Narcan. That's not the rule everywhere. It is with the police departments we work with, and that's exceptional for the communities that we serve, that happens. And we're also fortunate that Pennsylvania and Allegheny County Department of Health have great programs to supply Narcan to us, to do Narcan leave behind programs, keep our police department supplied, and all those kind of things. So it works very well for the community. So those things are important as well. So many people have Narcan. It's a little unsettling sometimes. Not unsettling, it's getting used to it when you show up and somebody's had Narcan. It works really well. There's times I know that people becoming accustomed to Narcan works. So somebody overdoses, they give it to them, they wake up, and they don't call EMS. They don't call for help. And that turns out okay. Xylazine changes that game because Narcan will not reverse it. Should you still give Narcan? Yes, because we don't know what's in that bag. It's been said so many times tonight that you don't know what's in there. And there's a good chance there's fentanyl in there, there's heroin in there, some opiate, right? And the Narcan's going to help that and might help to improve their breathing. But if it's xylazine, it's not going to fix the problem completely. So you should call for EMS. You should think of doing it earlier with what we're talking about tonight. And if we get there, we're not needed, so be it. We're going to check the person out, we're going to turn around, we're going to go home. And that's the better and safer way to handle these circumstances. That's what we're here for. So, please, please, please do that. Sir, back to your question about the oxygen. It's not oxygen that's important. Both of these, xylazine, fentanyl, heroin, all depress your breathing, your drive, right? So if you stop breathing, you don't need oxygen. You need air forced into your lungs. So just having oxygen, unless it's through a bag valve mask or some device to force it into your lungs, isn't enough. So that's what we provide. We'll show up with bag valve masks if we need to put in a tube to help somebody breathe and so forth. We can do all of those things. So just the canister of oxygen alone isn't going to do it. So again, it's a reason to call us and let us help figure those things out. Narcan, you saw a picture of it in the presentation. This is 4 milligram spray. The box you saw has 2 of these. So there's 8 milligrams in a box. When we give it, we give 0.4 milligrams. So this dose just many, many times that we have had, and this isn't meant to train everybody how to use Narcan tonight, right? Please take the time. We do the training. If you have other place you can get the training, please take the time to do that and learn how to do it properly. But it really is important. The other thing we see though is we'll see, family members are concerned about their loved ones or friends or whoever, and they'll have everybody in the room has a box, and we'll show up and they'll have given like 8 doses of this. It takes time to work, and if the person isn't breathing, you can give it all and it won't matter. So if somebody's in cardiac arrest, we won't give this. We have other things we have to do first. So this is expired. So this is very simple, but all you're gonna do is open this up. This comes out, and you're gonna insert it in the nostril and just push. It's that simple, right? And that's as simple as giving the med. The benefit and the beauty of Narcan is that if they don't need it, it doesn't harm you. So if somebody gets this that didn't need it, 0 harm, 0 risk.
Inappropriate doses.
So inappropriate doses, too much can cause risk and cause respiratory problems, a whole bunch of other issues. So there is not only just overuse, there can be down medical sides to it, or downsides to medical issues as well. But proper usage is very simple when done correctly. The question, if you're not sure, you think it's xylazine, still give Narcan, absolutely. Public dose versus EMS dose, we talked about that. A little bit about your question about, I am not an addiction specialist, but I will tell you that my experience has been, what I've seen over the years, is that people can recover. I can't talk about xylazine, it's a newer thing, but certainly with people with addictions, it's really hard. It's really hard. But what the agent said is that people have to want it first. Yeah, absolutely, incredibly true. One of the most poignant stories that I remember from my time, it wasn't in the communities I currently work in. It's another place. I showed up, picked up a young kid, he was 19 years old, talked to me for something completely unrelated to a drug addiction, but just talked to him, and he was just kind of seemed sad, and we're talking, we're going to the hospital, and I said, your sweatshirt looks really familiar, a very distinct sweatshirt with something embroidered on it, and I said, I've seen that before, and he said, well, I used to have a drug addiction problem, and it all of a sudden popped in my head. I said, did I treat you? And he said, no, it was my brother's. He was wearing it, we died. And I said, how'd you get out of it? And he lives in a trailer in the middle of nowhere. He said, because I've gotten away from my life entirely. Every person I've ever known, I've gotten away from, to get away from that life. This was an incredibly nice kid. And he had to change everything about him to get the treatment and get away from it. So, that's what I saw in one case that it took. And I hope that kid's doing great today. It was amazing to talk to him. But you hear these stories and you do see people that get better. And that's why we do these things, so they have a chance to get better. That's certainly what we hope for. So, what else would you add?
I think Gary did a very good job at hitting the high points that we drive home. The difference between a medication and a poison is the dose, right? So we use fentanyl and ketamine just like we do Narcan. In the right dose, they're healthy and they're useful. In the wrong dose, it's a poison. An overdose is essentially a poison. Narcan is in that same vein. If we give too much Narcan, it can become a poisoning. So Narcan is not the replacement for all of the other things we need to do to help people that are having emergencies. It's an added tool, right? It doesn't take the place of CPR. It doesn't take the place of bleeding control. It doesn't take the place of positioning somebody in the right position if they're vomiting. All those things are still very important to us. So it's okay to give a Narcan, or maybe even two, but in the absence of a return of spontaneous breathing, that mechanical ventilation that Eric talked about, we need to start to think about other things to help them. And that other things is maybe body positioning, opening their airway, mouth-to-mouth rescue breathing. And when I say that kind of with a forked tongue, because now we're worried about the scene safety situation, and we're saying you might want to do mouth-to-mouth. So I would add in there, if you're going to do that, use a CPR mask or some type of breathing barrier to protect you. And then it's a good segue into the other thing. We mentioned briefly the police officer that had an exposure and a pretty good scare. This is very frightening for us when we see things like this. So we're going into these homes wearing gloves, oftentimes masks, eye protection. Folks that are around that don't always have those things. So I think what Sergeant Stelitano said is very important. If you stumble onto something that looks odd, don't be afraid to call for help. We'll gladly send somebody out to remove that. We'll gladly answer any questions you have. I think one of the things that we run into often is the perception that police and EMS are tainted with drug overdose patients because we see so many of them. For us, it's no different than somebody that's a non-compliant diabetic, a non-compliant heart attack patient that doesn't take their blood pressure medicine. It's just another medical issue. And we'll treat that person with the same dignity and respect that we will everybody else. And please call for help. Don't think that you can do it on your own with Narcan or oxygen. We're there for those reasons. If you don't need to go to the hospital, we'll gladly tell you that. We don't want to take people to the hospital that don't need to go. These guys in the back will gladly agree with me. We do that all the time, but we would rather be there and err on the side of caution, provide that assistance, do whatever we can to educate, help people when we can, and not be needed rather than be needed and not be there. So.
Online question, is there any particular symptom that flags you to xylazine when you arrive in an overdose call?
There's not. We might suspect if we give Narcan, they don't start waking up, but we don't know. It's a testing process after the fact. You know, we're gonna approach the same. We're gonna give Narcan. We're gonna assist the breathing if we need to. We're gonna do general supportive things, but we don't know that fact, or that we can't figure it out. We'll know after the fact.
So medical decisions and treatment protocols are really driven by high volumes of data, right? And in the case of xylazine, we have less than a year of data, and the numbers we saw here tonight are staggering for our little communities, but they're really small numbers when you think about that from a medical data perspective. The one thing I think we have seen that's pretty important to drive home is the additional need for respiratory support. People not responding to Narcan, not responding to airway control or bag valve mask ventilations, and requiring more of that ventilatory support that we're not used to seeing.
To the mouth-to-mouth recovery, if you believe that it comes to that, is there a safe way to proceed with something like that? Is there precautions you should take?
If you don't have.
If you don't have the mask, or you know what I mean?
So a CPR mask does two things. One, it creates a barrier from your mouth touching somebody else's mouth. And the second thing is it prevents vomit from coming back out of that person into your mouth. In the absence of a CPR mask with a one-way valve, the only barrier we could kind of create in a home would be essentially plastic wrap or cellophane or a Ziploc bag or something like that, just to create that barrier. But it's only going to do one of those two things and prevent the contact. It won't prevent the return of vomit if that person
there has to be a hole in it, you know.
Right.
Yeah. The best answer really is you have to be trained in that.
Right.
It really is. It does go further than what we're talking about. And in today's day and age, you know, hands only CPR has been developed because people are so, and I understand, cautious about wanting to do the mouth-to-mouth part of it, right? And they found through science that hands only CPR helps in the short term, right? Helps to buy more time. So if it's your loved one, you're probably going to do that in this circumstance. But you still have to know how to do it. It's beyond our scope, and I can teach you how to do that correctly and safely. Yes.
Have you had to up any wound care education in the police department because of that wounds?
I think it's BSI, we worry about it all the time. We wear gloves all the time. It hasn't changed that.
What it would change is if we see that on a patient that we might have otherwise not transported, that would be an indication for transport, just because that tissue damage is significant. That could result in infection, sepsis, amputation, death, some other things unrelated to the overdose that could be very, very problematic.
Do you provide any kind of first aid wound care support there, or would you have the hospital do that?
Any open wound we would cover and treat, depending on the wound, irrigate it, wrap it, bandage it, those types of things, but it really requires a wound care facility for a wound like that.
Okay, yeah, because I was gonna ask, like, have you had to, like, up that training, or you just leave it to?
We honestly don't know enough about it yet to be able to answer that, but
Okay.
I can tell you, we are very engaged in training through the events like this, and there's another one coming up next week specifically for responders for overdose care, wound care, precautions on scene. So we're learning all that stuff now.
Thank you.
Just to jump on something earlier that you had addressed with her about all hope's not lost with somebody that's on drugs. We as police have seen them. They've come to the station and talked to us after we've arrested them, and we knew they were addicts for X amount of years, and they were doing good and they were clean for a year or two, and they come up and they talk to us and they tell us that they're doing well. But like Eric said, they have to get away from that lifestyle that they're used to, and there's always something that could maybe trigger it. But hope's not lost with this.
I just wondered if these drugs are more. And my son is 16 years off of methamphetamine. My brother, cocaine overdose. My sister, opioids, still using. Can't do anything about that. But I just wondered if, since they're making these drugs so much more powerful, is it harder than the other ones that were more pure, like the cocaine of the 80s, to get off of?
I think it's always been difficult, you know, it's the definition of addiction, right? Yeah.
The mental thing is I just wondered if people were seeing less people recovering than they were in the past.
I don't know that answer. I hope that's not true, but I don't know.
I know.
Thank you.
Thank you.
Thank you.
So as you hear tonight, I mean, we have a lot of experts here. We really appreciate the interaction, the questions, the online questions. We put this together very quickly because we wanted to get the word out, and we do appreciate this. Shaler, Etna, and Millvale Police about 2 years ago worked through the Department of Human Services in Allegheny County, and we have developed a partnership with Passages to Recovery. We participate in the LEAD program, that's Law Enforcement Assisted Diversion. So, you know, our job isn't just to arrest people, and that's why we're having this program. We are the helpers. So the drug dealers, we have no sympathy for. The people that are addicted, it is an illness, it's a sickness. And once they get addicted, it's very difficult. So we have Passages to Recovery tonight to talk a little bit about that. And we're gonna have some resources that the county has given us to pass out, and we'll share those online as well. So Andrea Moore from Passages to Recovery is gonna speak for 5 or 10 minutes, I think.
Thank you for having us. We were coming out tonight just to get some more information. What Chief was talking about is we are a collaborative, a community partner within Etna, Millvale, and Shaler. Tonight I have with me my co-workers, Keith Mangan Jr., as well as Dave Shelton, who are really doing some direct care with those within the community. What's happening is LEAD's purpose for being in the community is to work with those individuals who are frequently arrested. And it could be due to some poverty issues, but a lot of times it's due to substance use disorders, okay? You may hear addiction or something like that, but we're learning new verbiage and we're saying substance use disorders and things of that sort. So it's our job to be case manager to them, to get the resources to them in a harm reduction way. What does that mean? We hear that term all the time. Basically, we're allowing them to kind of like chart their own course. What is it that you want to do? Do you want treatment? Do you not want treatment? How can we help you stay away from the cops, but yet and still help you to get to where you need to be. So they set goals, and it's our job to be the GPS and to guide them to where they want to be. So that is our point. That's our purpose of being in the community. One of the things that we're excited about, this program, like Chief said, launched probably 2 years. We came on the scene a year later. So the program has been functioning for at least a year. One of the things we're excited about is even here in Shaler, right here at the Bethlehem Church, we have drop-in sites at least one day a week. I think that's Monday, right, Keith? Monday, we're there from like 11 to 2. On Wednesdays, we are in Millvale, same time at the community center. And Etna, we're at the Lutheran Church. Yes. So I always think Pastor JJ. Same time. And we're there to offer support to those individuals, whereas if they don't have transportation, they can get to us if they need some type of support. What we're finding is the program works. We're finding that people are learning to engage, trust us. You know, sometimes if they're referred by a police officer, sometimes you're like, I'm not sure if I can trust you. But when we're showing up and being consistent, showing them that we're there to support them in any way, form, or fashion, we're seeing results. And we're celebrating the small wins, okay? So if they give us a text message back, we're excited, right? If they call us and say, hey, you know, can you meet me at court? We're excited. We're excited because we're celebrating the small wins. And we're finding that a lot of people are not fortunate to have that consistent support. And that's what we offer. And we're in the community supporting these individuals in any way, form, or fashion. But as I'm nicknaming you right now, Mr. D, because I can't remember your last name. But when he was sharing the statistics, I've been in the social service field over 30 years. I know I don't look it. But over 30 years. And I started out with teen moms. And I almost welled up because unfortunately, I started with teen moms. I was able to see a young man be born. 2020, I saw the same young man in a casket, and it was due to a fentanyl overdose. He was sitting on the couch. Nobody knew that he had taken a pill for anxiety. Sat on the couch, went to sleep, never woke up. And so what he's talking about, you know, it's real. We see it hands-on. And it's not anything that we just want to feel good about, but these are things that we're living and have lived. And that's the reason why we're involved in the work that we're in. So if you have any questions, I do have some brochures. Keith or Dave are willing to help. And we are just glad that, you know, the chief of police are trusting us to be within their community to offer these type of services. Any questions? Yes, ma'am.
This one might be for the chief. The question is, can other nearby communities join LEAD?
Oh, I'm glad you asked that question. Absolutely. If they would like to, they can reach out to me and I will connect them to the right people. But absolutely, we will welcome more people into our cohorts. And that's how we function. Right now, Etna, Millvale, and Shaler are our North cohort. There's going to be a Pittsburgh lead where they're just within the city of Pittsburgh. We also are working in the East, where it's, here I go, Braddock Hills, Forest Hills, Churchill, Shelfawn, Wilkins Township, and Swissvale. Thank you. So those are the communities in which we're in right now. But yes, we are welcoming more people. There's talks about Penn Hills supporting us, and a part of the North cohort is Westview. And Aspinwall. Yes. Okay. So yes, great question.
How will they contact you?
Phone number is. Is that my number on the back? Okay. No problem. 412-867-7901. My name is Andrea Moore.
So any of the resources that we're going to hand out, Sharon with the library is going to be able to take these and post them. She can post part of the lead flyer, their brochure. She could probably leave some here at the library. We have brochures at our station. I'm sure Etna and Millvale have them at their station.
Is
So
that
we-
the Bethlehem Church on Mount Royal? here?
Yes.
That's
The one
where
right
their
by the
office
library
is.
across the street?
Yes.
Yes.
I
Yes.
never know the names of it.
Right. So as a wrap-up, are there any other questions here from the audience? Again, as I said before, we really thank you for your participation tonight. We hope that you got something out of this, and we hope that it spurs more conversation. And, once the new year passed, maybe we'll have some updated information. We work hand in hand with EMS, as they said. We'll be doing the training that they're going to take next week. Any online questions, Sharon?
I have a question just about like, how severe is the drug problem in that area? Or, I don't know if that's a right question, but
It's hard to gauge. It's cyclical. I mean, you'll have a couple of overdoses and then you'll go weeks or months without them.
and then like, just like stopping people with drugs, I mean, you see a lot of that
Fairly often.
fairly often.
Chief, I wanted to, I think it was you now that had asked the question about people recovering. One of the things that we find is, the recovery starts when they deal with the issues. It's not always, the addiction comes from a trauma or issue that they haven't resolved. And if, once you begin to deal with that, then you see recovery. If you don't deal with that, then it's a constant, you'll see the constant relapse.
And just a resource for family members who wanna get in touch with more of what addiction is and how families suffer from addiction. You can always look up Al-Anon for the family support. And like always offer a family member who suffers from substance abuse disorder, there's always 12-step process. That they can find support in the 12-step process.
I just had an experience at the election day. I work at the schools. So we had 2 kids from Fox Chapel that were seniors because it's part of their schooling. So I was with them, from 7 in the morning till 8 at night. So I just started asking, what's it like in these schools? I hear this stuff about the vaping. I mean, I was shocked how much vaping, and now it's like with the nicotine in their mouth and the corner of their mouth, they're telling me, and I just said, don't these kids learn from like their parents and grandparents that died? They said, no, they won't. It just seems like I feel like it's worse than it's ever been.
It's a constant battle, that's for sure.
I just was like, as the day went on, they opened up a little bit more about the school, and I was like, wow. Why are these kids doing this?
Sharon, another question?
Online question, how does Shaler area drug issues compare to the past or nearby communities?
Again, it's a cycle that we're constantly battling. I can't say that there's more overdoses this year than there were 5 years ago. We're just seeing the different drugs that we talked about tonight, and that's really the big difference, that things are getting a lot more deadly.
I did want to add, a couple of weeks ago, I met with the Shaler High School school resource officer, and I collected all the vapes he had seized from students. I'm having those sent to NMS Labs for analysis. I'll report to the chief my findings. We did this last year. We did throughout several school districts throughout Western PA. We found from a lab analysis that half the vapes were nicotine and half were THC. So I'll be sure, once those findings come in, which will probably be by March, I'll provide those to the chief. So what we're seeing in the high school at least.
And maybe at that time, Brian, we can do another presentation
Absolutely.
and talk about vapes and talk about what's going on in schools. Any of the speakers that have any last minute things that popped into their mind that they wanted to say or ask before we close? Okay, again, thank you for your participation tonight. Any online questions that come in later, I'm sure Sharon will field them and get them to us. Thank you and good night.
Thank you, Chief. Thank you, Chief.
Yes, I know.
Thank you.